All right, welcome to the deep dive. Today, we're going deep on the American Diabetes Association's updated standards of care in diabetes for 2025.
Oh yeah, these are big.
Yeah, they just came out, so we're working straight from the source, their detailed summary in diabetes care. And whether you're, managing diabetes personally or a healthcare pro, there's a lot to unpack here.
Oh, a lot.
Yeah, a lot. First thing that really jumped out at me is how the ADA is, really pushing for person-first language.
Yeah, it's people with diabetes, not diabetics. I think it's a good thing. It's empowering.
Yeah, definitely. Small change, but it can make a difference.
Right.
And they're not alone either. The ADA's got like the American College of Cardiology, the American Geriatric Society, all backing these standards.
Yeah, it's a real team effort, and especially with the American Geriatric Society actually endorsing the older adult section. This is the first time they've done that.
Oh, wow.
Yeah, it's recognizing that diabetes care for older adults can be a bit different.
Makes sense. Okay, so let's dive into the actual changes. Section 1, improving care, really caught my eye.
Right.
It seems like they're way more focused on reaching diverse communities and making sure everyone gets the care they need, no matter what their background is or their situation.
Right, right. It's about recognizing that diabetes doesn't exist in a vacuum.
Yeah.
Things like having access to healthy food, or affording decent housing, or even cultural beliefs. All that stuff can play a huge role in how someone manages their diabetes.
It's true. It's not just about the numbers,
You have
right?
to have the whole person.
The whole person. Okay, now Section 2, diagnosis and classification. This one has a new approach for those trickier cases where someone shows signs of both type 1 AD, type 2 diabetes.
Right. It's kind of recognizing that diabetes isn't always black and white. So
Yeah.
this new approach, it allows for more personalized care for those who don't fit neatly into just one box.
I like that.
Yeah.
Plus, they've added this antibody-based screening for people who are at high risk of developing type 1.
Yeah, early detection is so key, especially with type 1. It can really make a difference in those long-term outcomes.
For sure. Now, Section 3, prevention. I love this. They finally acknowledged something I've been saying forever. Sleep matters.
It's about time. Sleep is finally getting the recognition it deserves as like a core part of both prevention and A&D management. I mean, think about it. Enough sleep helps regulate your hormones, your metabolism, your stress levels, all things that are super important for staying healthy.
Right. Sometimes I think people just tune out when you start talking about sleep, but it really is connected to everything.
It is.
And there's some updates in this section, too, on vitamin D and using metformin long term. I'm sure a lot of people will be interested in that.
Absolutely. Understanding the nuances of vitamin D deficiency and how metformin can impact vitamin B12 absorption over time, that's crucial for making informed choices.
Okay, buckle up, because Section 4, comprehensive evaluation, is massive.
Oh, yeah, it's huge.
It covers so much new stuff,
Mm.
especially around sexual health and diabetes, which, doesn't always get talked about.
Right, it's often overlooked. But diabetes can have a real impact on sexual health for both men and women. And these guidelines, they give some much needed advice on how to address these issues openly and, in a proactive way.
Yeah, like they're actually recommending that doctors specifically ask men about erectile dysfunction and even check their testosterone levels.
Yeah.
And for women, it's about talking about issues like, female sexual dysfunction and genitourinary syndrome of menopause, which can be made worse by diabetes.
Yeah, it's about creating that space, that safe space for open communication and making sure those sensitive topics are addressed as part of, just routine diabetes care.
Exactly, exactly. And remember NAFD and NASH, those terms for fatty liver disease?
Oh, yeah.
Well, they've been updated to MASLD and MASH.
Mhm.
That's metabolic dysfunction-associated steatotic liver disease and steatohepatitis.
It's a mouthful.
It is a mouthful.
But it's the new terms, they reflect a deeper understanding of how these conditions develop and how they're really tied to metabolic processes.
Right. It's not just about fat in the liver anymore.
Exactly.
So there's a whole new algorithm for assessing liver health and preventing further damage.
Yeah, that's a big one. And there's a whole bunch of new recommendations for medications and combination therapies.
It's a lot.
It is. And speaking of things that can be a lot, there's also a whole new section on dental care.
Oh yeah, this is interesting. Why is dental care even in the diabetes standards?
Well, because there's this really strong connection between oral health and diabetes.
Ah,
like a two-way street. So people with diabetes, they're more likely to get gum disease, which can actually then mess with their blood sugar control.
Wow.
And then the meds used to treat diabetes, sometimes those can affect oral health too.
So it's all connected.
It is. The new recommendations really emphasize, going to the dentist regularly and making sure your dentist and your doctor are like talking to each other.
That makes sense.
Mhm.
Okay, let's move on to section 5. This is positive health behaviors. No surprises here. Diabetes, self-management, education, and support, or DSMES, it's still like the cornerstone.
Absolutely. DSMES, it's all about, giving you the knowledge and skills to really take charge of your health. It's about understanding your condition, making good decisions, and building those healthy habits that work for you, not just some generic advice.
And it's not just about attending like a class or reading a pamphlet. They're really stressing that DSMES needs to be tailored, like personalized
Yeah.
to each person's needs, their culture, all of that.
It has to be. It has to be accessible, engaging, relevant, and, it's not just for the person with diabetes either.
Oh, right.
Family, caregivers, they can all benefit from learning about diabetes and how to be supportive.
That's so important because diabetes, it affects everyone in the family.
Yeah, it really does.
Okay, let's talk nutrition. The new guidelines are getting tougher on processed foods. They really want people to cut back.
Makes sense. Processed foods, they tend to be high in sugar, unhealthy fats, empty calories, not good for anyone, especially if you have diabetes.
Yeah, that's fair.
They also emphasize lean proteins, and there's even a new recommendation on non-nutritive sweeteners.
Ooh, I always wondered about those. Good or bad?
It's complicated.
I bet it is.
They still say whole, unprocessed foods are best,
Of course.
but they also say those non-nutritive sweeteners can help reduce sugar and calories if they're used, in moderation short term.
Okay, so not a free pass to drink all the diet soda you want, but
Right, not a free pass.
but they can be a useful tool. What I thought was really cool is for the first time, they have specific recommendations for people who observe religious fasts.
Yeah, that's huge. It shows they're really, trying to be more culturally sensitive. There's even a risk assessment tool for folks who observe Ramadan, so it helps people manage their diabetes safely while still honoring their religious practices.
It's about finding that balance.
Exactly.
Speaking of balance, the physical activity recommendations, they're now suggesting breaking up long periods of sitting, even if you're, getting your exercise.
Yeah. Turns out, even if you hit the gym sitting for hours on end, it's not good. It can mess with your blood sugar. They say get up every 30 minutes at least, move around,
So set a timer, take a walk, do some stretches, whatever.
whatever works.
Okay, this next one, I was surprised. There's new guidance on cannabis use and diabetes.
Yeah, this is specifically about cannabis hyperemesis syndrome. So it's this condition that causes really bad nausea and vomiting.
I've never even heard of that.
Yeah, and it can be triggered by chronic cannabis use, which can be a real problem for folks with type 1 diabetes or those who are prone to diabetic ketoacidosis.
Wow, so important to be aware of the risks.
For sure. If anything seems off, definitely talk to your doctor.
Always good advice.
Hmm.
All right, and of course, we can't forget about mental health.
Right, right.
This is so important. Diabetes, it's tough mentally and emotionally, and, we need to make sure people have the support they need.
Absolutely. The standards are great. They go beyond just acknowledging the problem. They actually recommend screening regularly for, things like diabetes, distress, depression, anxiety, disordered eating behaviors.
Wow, that's great.
Yeah, they want to make sure mental health is addressed as part of just regular diabetes care.
It really is just as important as physical health when you're trying to live well with diabetes.
It is. It really is.
Okay, we've covered a lot in Section 5. Now on to Section 6, glycemic goals and hypoglycemia. There's a new section here on hyperglycemic crises, things like DKA and HHS, with recommendations for how to prevent them.
Yeah, this is key because DKA and HHS are serious stuff. They can be life-threatening. So the guidelines, they emphasize checking for risk factors regularly and making sure people who are at risk are getting, really good education on how to prevent those crises.
So they're not just waiting for it to happen, they're trying to stop it before it even starts.
Right. And there's also a shift away from those strict A1C targets. They're recognizing that what's considered a good blood sugar level, it can really vary from person to person.
So not one size fits all anymore.
Right.
I like that.
Yeah. Factors like age, overall health, risk of lows, it's all taken into account now when they're, setting goals.
It's a smarter approach. Okay, here we go. Section 7, diabetes technology. This is where it gets really exciting. I mean,
Mm.
technology is changing everything, and diabetes care is no exception.
Right. It's incredible what's happening. The standards definitely reflect all that. One of the big things is they're emphasizing starting tech early, maybe even at
Wow,
diagnosis.
so not waiting until there's a problem. Just like get on board with the tech early.
Yeah. Using things like CGMs and insulin pumps, it can help people gain better control right from the start.
That's great. And speaking of CGMs, they're pushing for standardized reporting across all the different devices and systems out there.
Yeah, it's about time.
Imagine being able to compare data from different brands easily. It would make it so much easier to, analyze trends and personalize treatment plans.
It would. It would make a huge difference.
And there's more talk about using CGMs for folks with type 2 who aren't on insulin, which is interesting.
Yeah, it's a shift. CGMs used to be mainly for type 1, but now we're seeing more and more evidence that they can be really helpful for type 2 management too.
Even without insulin.
Even without insulin, it's about, helping people see their blood sugar patterns better so they can make healthier choices.
I love it. And of course, we can't forget about insulin pumps and those automated insulin delivery systems, the aid systems.
Those are really changing the game. Aid systems offer a level of automation and precision that was unheard of just a few years ago. They can help people get better time in range, fewer lows, and just, make diabetes a little easier to manage.
It's almost like having a personal assistant for your diabetes. Yeah,
Yeah, it's pretty amazing. And they're not for everyone, but the evidence is really building up, showing the benefits for both type 1 and type 2.
that's awesome. There's also a cool section on those open source closed loop systems, which are basically DIY systems, built by some really techie folks in the diabetes community.
Yeah, it's amazing what people now, which I think is really important. They're saying that people using those DIY systems need, proper support and education too.
That makes sense.
It does.
They need to be safe.
Exactly.
I'm also super interested in this new recommendation about combining technology with online or virtual coaching.
Oh, yeah, that's smart.
Right. It's like tech gives you the tools, but having that personal guidance and support, that human touch,
Yeah.
can make a huge difference in how well you use those tools.
Yeah, it's about bringing together the power of technology and that human connection.
Exactly. Okay, moving on to Section 8, obesity and weight management. They're really pushing to look beyond just BMI.
It's about time. BMI is just one data point. Things like waist circumference and how your body fat is distributed, those can give you a better sense of, your risk for certain conditions.
Right. And they're recommending monitoring those things regularly.
Yeah, especially if you're trying to manage your weight, it lets you catch things early and make changes to your plan if you need to. They also talk a lot about weight stigma and bias.
Yeah, which is so important.
Yeah, we need to create a safe space, a supportive space for people of all sizes.
Absolutely. And there's a new recommendation on screening for malnutrition, especially after bariatric surgery or when someone's taking certain weight loss medications.
It makes sense. When you lose a lot of weight quickly, it can lead to nutrient deficiencies if you're not careful.
Right. And then they wrap it up by emphasizing how important ongoing support is to maintain that weight loss.
Yeah, weight maintenance is often the hardest part. So they're really stressing the need for, that ongoing support, whether it's through lifestyle changes or therapy or even medication.
Okay, ready for a big one. Section 9, pharmacologic approaches to glycemic treatment. Lot to unpack here.
It's a monster section. It's been completely revamped. The big emphasis is on personalized medicine, so choosing meds based on individual needs and goals, not just A1C.
So it's not just about like, here's the drug for this A1C level anymore.
No, it's more nuanced now.
I like it.
Yeah, they're considering things like your risk for heart problems, kidney health, what your weight goals are, even your personal preferences, all of that.
That's amazing. Like they're saying GLP-1 receptor agonists are now recommended for people with heart failure with preserved ejection fraction. That's a tough condition to treat.
It is, and it shows that, GLP-1 RAs, they do more than just lower blood sugar. They have real benefits for the heart. There are new recommendations for medication choices for people with MASLD or MASH2.
Right, taking that liver health into account.
Yeah, it's all connected. And then there's a whole new part on special situations, like if there's a drug shortage or if someone's pregnant or trying to get pregnant or, how to reduce the risk of ketoacidosis with those SGLT2 inhibitors.
That's a lot of detail.
It is, but it's important stuff. It's about recognizing that that everyone's experience with diabetes is different. And we need to have, safe and effective options for every situation.
Absolutely. Okay, Section 10, cardiovascular disease and risk management. I'm
Yeah.
guessing there are some big updates here, given how often people with diabetes have heart problems.
Oh, yeah, the section is loaded. New blood pressure guidelines, for starters. High blood pressure is a major risk factor for heart attacks and strokes, so keeping it under control is crucial.
So what's changed with the guidelines?
They're more specific now. They give better advice on, how often you should check your blood pressure and what those target numbers should be.
Okay, makes sense.
They also have new recommendations for those lipid-lowering therapies, taking into account if someone is pregnant or not, which is important.
Yeah, some meds aren't safe during pregnancy.
Right, so they're making that clear. And then there's a new recommendation for PAD screening in people who aren't having symptoms.
PAD. What's that?
PAD stands for peripheral artery disease. It's when the blood vessels in your legs and feet, they get narrowed or blocked. It can be really serious. You can have pain, numbness, and even lose a limb if it's not caught early.
So they're saying screen everyone, even if they feel fine.
Exactly.
Yeah.
Catch it early, treat it early, prevent those serious complications. That's the goal.
Makes sense. Okay, we're getting there. Section 11, chronic kidney disease and risk management. Big focus on keeping blood pressure under control, right?
Yeah, high blood pressure is really hard on the kidneys.
Yeah.
And there are new guidelines for choosing medications. They're looking at your kidney health, whether you're pregnant or not, all of that.
Again, with the pregnancy, it really does change everything, doesn't it?
It does. So these guidelines, they're super clear about which medications are, safe and effective for people with kidney disease who are pregnant or thinking about getting pregnant.
That's great.
No.
Okay, next up is Section 12, retinopathy, neuropathy, and foot care. This is all about those complications that can affect different parts of the body.
Exactly. So diabetic retinopathy, that's the one that affects your eyes. It can lead to vision loss if it's not caught early. The new standards have more specific guidance on how often you need to get those eye exams.
Based on your risk, I imagine.
Right. And they're not recommending opioids for nerve pain anymore.
Oh, that's right.
Opioids, they're just too risky, especially if you use them long term. So the focus is shifting to other ways to manage pain, things that are safer and more effective in the long run.
Makes sense. What are some of the alternatives?
It depends on the person, how bad their pain is. But there are other meds you can try, or physical therapy, even acupuncture.
Oh, wow.
Yeah. And there's a new tool in the toolkit now, too. It's called the Ipswich Touch Test.
What's that?
It's a simple test. It helps doctors check for nerve damage in your feet. It's super common with diabetes.
It's like a quick screening.
Yep. Just takes a few minutes, and it can help spot those who might need a closer look and treatment for neuropathy.
Awesome. Okay, we're almost done. Section 13, older adults. This one introduces the 4Ms framework for age-friendly care.
It's a nice framework. The 4Ms stand for mentation, medications, mobility, and what matters most. So it's really looking at the whole person.
I love that. It's not just about their age or, their diabetes.
Exactly.
And they've changed how they're thinking about A1C goals for older adults, too. Now they're adding in time in range and time below range.
Yep. Time in range is how much time your blood sugar is within a healthy range. Time below range is, it's how much time your blood sugar is too low. These can give you a much better picture than just A1C alone.
So it's not just the average, but also how much time you're in the good zone and how often you're having lows.
Exactly. It helps spot people who might need to tweak their treatment, even if their A1C looks okay on paper.
It's about getting that deeper level of detail.
It is.
Okay, let's talk about Section 14, children and adolescents. Lots of important stuff here.
Yeah, from nutrition to exercise to A1C targets to mental health, they cover a lot.
What are some of the big changes?
One big one is they're now recommending insulin pumps for all kids and teens with type 1 who can use them safely.
Oh, wow.
Yeah. There's more and more evidence showing that pumps can really improve control and quality of life for young people.
That's great. Anything else?
They've updated the A1C goals, and they're really focusing on, healthy lifestyle habits, eating right, limiting screen time, that kind of thing.
Building those good habits early.
Exactly. And just like with adults, mental health is a big focus in this section. They want all youth with diabetes to be screened for, things like depression, anxiety, eating disorders.
So important. Diabetes can be really tough on kids and teens emotionally.
It can. So it's crucial to get them the support they need early on.
Okay, almost there. Section 15, management of diabetes in pregnancy. I mean, this is a whole other ball game, right? Pregnancy can really change how you manage diabetes.
It does. So this section has been completely reorganized to address the unique needs of pregnant women with different types of diabetes.
So they're separating out like pre-existing diabetes, whether it's
Okay.
type 1 or type 2, from gestational diabetes.
Right. And they have specific recommendations for each, including new glucose targets and CGM recommendations.
Keeping blood sugar under control during pregnancy is so important for both mom and baby.
Absolutely. They also have two brand new recommendations on using aid systems during pregnancy.
Wow, that's cutting edge.
It is. Aid systems are fairly new, so their use in pregnancy is still being studied. But they have the potential to really improve things, better blood sugar, less burden for moms.
I could see that. And
Yeah.
they've given clearer guidance on medication choices too,
Mhm.
right? Including statins,
Yeah. It can be tricky figuring out which meds are safe during pregnancy.
I bet.
So these guidelines, they really help doctors, weigh the risks and benefits.
Okay, last one. Section 16, diabetes care in the hospital. Managing diabetes in the hospital, that has to be tough.
It can be. Blood sugar can be unpredictable in the hospital, so this section has new recommendations for treating high blood sugar, both for, critically ill patients and those who aren't as sick.
So tailoring the approach based on how sick the person is.
Right. They're looking at their med history, what they can eat, their overall health, all of that.
It's about getting that full picture.
Yeah.
Yeah.
They're also recommending that people stay on their pumps or aid systems in the hospital whenever possible.
Makes sense. Don't want to disrupt something that's working.
Yeah, it could make things worse. And they've updated the guidance on managing DKA and HHS in the hospital, too.
Okay, so not just while they're in the hospital, but also making sure they have a smooth transition back home.
Right. It's about that continuum of care.
Okay, we made it. All 16 sections of the updated standards of care. Wow, that was a lot.
It was a lot.
But I think we got through it. What really stands out to you after going through all this?
Honestly, it's just, it's how personalized and holistic it's all becoming. It's not just about managing your A1C anymore. It's about understanding you as a whole person and what you need and what your goals are.
I'm with you on that. And the technology is so exciting. It feels like we're at the beginning of like a revolution in diabetes care.
Yeah, the tech is amazing, but we got to remember it's just a tool.
Right. You still need a good team, a good support system, good information.
Absolutely. You can't do it alone.
I think that's a great takeaway from these new standards. Diabetes care, it's a team effort.
It is. It's about working together, you, your doctor, your family, everyone.
Okay, but before we get too far ahead of ourselves, we've got one more section to talk about. Section 17, diabetes advocacy. It's not as clinical as the others, but it's incredibly important.
Yeah, this section covers, things like diabetes care in schools, driving with diabetes, even diabetes management in detention facilities.
These are all situations where people with diabetes can face, real challenges and even discrimination.
Right. It's about protecting their rights and making sure they have access to the resources and support they need to thrive no matter where they are.
It's about making sure everyone has an equal chance.
Yeah, removing barriers and creating a more inclusive and supportive world for people with diabetes.
I love that they included this section. It
Yeah.
shows they're thinking about the bigger picture.
It does. It's about the whole person, the whole experience of living with diabetes.
So, after all this, what's the one thing you hope our listener takes away from this deep dive?
I hope they feel hopeful.
Hopeful, yeah.
These updates, they're a real step forward. They show that we're learning more about diabetes all the time and, finding new ways to treat it, new ways to help people live better with it.
I agree with you. And I hope they're also feeling curious. There's so much new information here, so much to explore.
Pick something that interests you, Maybe it's the tech, maybe it's mental health, maybe it's something else. Ask questions, do your research, stand up for what you need.
Exactly. This is just the start.
It is.
There's always more to learn.
Keep learning, keep growing, and, know that you're not alone.
All right, it's been great diving deep with you.
Same here.
And to our listener, thanks for joining us on the deep dive. We hope you found this exploration informative and inspiring.
Stay curious out there.
And remember, you've got this.
You do, yeah. It's amazing to see people coming together like that to support each other,
Totally. So let's talk about Section 17, diabetes advocacy.
Yeah.
This part might seem, a little less medical than the others,
Mm.
but it's super important. It covers stuff like diabetes care in schools, driving with diabetes, even managing diabetes if you're in like a detention facility.
Yeah, it really shows how diabetes, it affects every part of your life, not just your health.
Exactly. These are all places where someone with diabetes might face some really unique challenges and even, discrimination. Like think about a kid in school who needs to check their blood sugar or take insulin. They need to be able to do that, safely and privately without feeling awkward or like everyone's staring at them.
Right, and that's what these recommendations are all about. They're pushing for policies that protect people with diabetes, making sure they have the support they need to live their lives fully, no matter where they are.
It's about breaking down those barriers and making the world a more inclusive place for everyone with diabetes.
Yeah,
I'm
exactly.
really impressed with all these updates.
Mhm.
There's so much to take in. But I think if I had to pick one big takeaway, it's that focus on personalized care.
Absolutely. It's moving away from that old one-size-fits-all approach, finally. Everyone with diabetes is different.
Right. Your age, your lifestyle, your cultural background,
Yeah.
what you want to achieve, it all matters when you're figuring out the best way to manage diabetes.
It's about putting the individual at the center, giving them the power to work with their doctor and come up with a plan that fits their life.
It's like we're going beyond just treating the disease. Now it's about caring for the whole person.
Exactly. Looking at their physical needs, of course, but also their mental and emotional health. And considering those social factors that can make a huge difference in how well they can handle their
It's
diabetes.
all connected, you know. And we can't forget about the technology, all the new stuff, CGMs, pumps, aid systems. It's already changing how people experience diabetes. And I bet we'll see even more amazing stuff in the next few years.
It's really exciting, all the innovation that's happening. Technology is giving people more control over their health than ever before. They can track their blood sugar better, adjust their insulin more precisely, even automate some of the stuff they used to have to do manually.
It's like having a whole diabetes management team right there in your pocket.
Yeah.
But like we've been saying, technology isn't everything. You still need that human connection, that support network.
Absolutely. You need a doctor who gets you, a good team, supportive family and friends, access to information and resources, all of that.
I think that's a really important message from these new standards. Diabetes care is a team effort, you know. It's not just you against the world. You've got people on your side. And working together, you can achieve amazing things.
It's about collaboration, about open communication, about making decisions together as a team.
So if we had to boil it all down, what are the one or two biggest changes you see in these updated standards? What do you think will make the biggest difference for people living with diabetes?
That's a tough one. There are so many. But I think the two that really jump out are that emphasis on personalized care and really seeing the importance of mental health. For too long, those have been kind of ignored or at least not given enough attention. So it's great to see them being front and center in these new guidelines.
Yeah, I agree with you there. Those are two big wins for everyone.
That shift to personalized care, it's really a game changer. It's about realizing that there's no one right way to manage diabetes. What works for one person might not work for another, and that's okay. It's about finding what works for you, what fits your life, your goals, your preferences.
And taking mental health seriously is long overdue. Diabetes, it can be really tough mentally and emotionally. You're constantly thinking about it, managing it, making decisions about it. It takes a toll.
It does. And these new guidelines, they're finally acknowledging that. They're recommending regular mental health screenings, and they're stressing the need for integrated care so that your mental and emotional health are treated just as importantly as your physical health.
Which they should be, you know? But I'm also thinking about our listener right now. All these updates, it can be a lot to take in. Some people might even feel a little overwhelmed by it all.
That's true. It is a lot of information. It's complicated stuff.
So for anyone who's feeling that way, it's totally okay. Just take a deep breath and remember, you don't have to do everything at once. Focus on the parts that resonate with you the most,
Yeah.
and talk to your doctor.
Yeah, your doctor is your partner in all this. They can help you understand what these changes mean for you and how you can use this new information to improve your own diabetes care.
It's about having those open and honest conversations, asking questions, and working together to come up with a plan that feels right for you.
And remember, you're not alone in this. There are so many people out there living with diabetes, and there are so many resources available to help you. There are support groups, online communities, educational materials, all kinds of stuff.
So reach out, connect with others, learn as much as you can. The more you know, the more confident you'll feel in managing your diabetes and living your life to the fullest.
Exactly. Yeah, it's really something, to see how far we've come in diabetes care, how much more we understand now. And it's great that these new standards are, they're really reflecting all that progress.
Absolutely. It's not just about the science either. It's about, changing the way we think about diabetes, changing the way we talk about it.
Right, it's about shifting the focus from just the disease itself to the person living with it.
So the whole person, their experiences, their challenges, their hopes, their goals.
Exactly. It's about recognizing that, diabetes is just one part of who they are. It doesn't define them.
Well said. So as we wrap up our deep dive into these new standards of care, I'm curious, what's the one thing you hope our listeners take away from this conversation? What's the message you really want them to hear?
Hmm. That's a good question. I guess more than anything, I hope they feel empowered.
Empowered, yeah.
These updates, they really are a big step forward. They show that we're finally starting to understand diabetes on a deeper level, and we're developing treatments and strategies that are, that are more effective and more personalized than ever before.
I love that. And I hope our listeners are also feeling, a little bit curious. Curious to learn more, curious to explore these new ideas and see how they might fit into their own lives.
Yeah, curiosity is key because these standards, they're full of new information. So I hope people will take some time to dig into the areas that really speak to them. Maybe it's the tech, maybe it's mental health, maybe it's something else entirely.
Okay, find what resonates with you and follow that thread.
Exactly. Ask questions, do your research, talk to your doctor, connect with other people in the diabetes community, and most importantly, advocate for yourself. Don't be afraid to speak up and ask for what you need.
Yes. This deep dive, it's just the beginning. It's a starting point for further exploration and learning.
It is. And the more you learn, the more you'll realize that, you really do have the power to shape your own journey with diabetes.
Well said. It's been fantastic diving deep with you today.
Likewise. I always enjoy these conversations.
And to our listener, thank you so much for joining us on the deep dive.
We hope you found it helpful.
We hope you learned something new.
And that you're feeling, maybe a little more hopeful, a little more inspired, and a little more in control of your diabetes.
Until next time, stay curious, keep learning.
And remember, you've got this.
You absolutely do.